Addiction is one of the most persistent and widespread challenges affecting individuals and societies in the modern world. It is often hidden, stigmatized, or misunderstood, but its effects are felt across all social, economic, and cultural boundaries. Whether it takes the form of substance abuse, gambling, compulsive internet use, or other harmful behaviors, addiction has the power to devastate lives, break families, and strain public health systems. Far from being a simple matter of weak willpower, addiction is a medically recognized condition, a brain disease that disrupts a person's ability to make healthy choices. The American Society of Addiction Medicine defines addiction as a chronic, relapsing disorder characterized by compulsive drug seeking and use, despite harmful consequences. This condition affects brain circuits involved in reward, motivation, memory, and control. Addiction begins when a person repeatedly engages in a behavior that activates the brain's reward system. This reward system is designed to reinforce survival activities, such as eating, social interaction, and reproduction, by releasing the neurotransmitter dopamine. Addictive substances and behaviors hijack this system, causing a surge of dopamine far beyond what natural rewards produce. Over time, the brain adapts by reducing dopamine receptors or producing less dopamine naturally. This adaptation creates tolerance, requiring more of the substance or behavior to achieve the same effect, and leads to dependence. At this stage, stopping the behavior causes withdrawal symptoms, both physical and emotional, making it extremely difficult to quit. Dr. Nora Volkow, director of the National Institute on Drug Abuse, has emphasized that addiction changes the brain's structure and function. Imaging studies show that addiction alters regions involved in judgment, decision-making, learning, memory, and behavior control. These changes help explain why addiction is a relapsing condition, and why willpower alone is often insufficient to overcome it. Addiction is not limited to drugs or alcohol. There are two primary categories. 1. Substance addictions. This includes alcohol, nicotine, opioids, like heroin or prescription painkillers, stimulants, such as cocaine or methamphetamine, cannabis, and other drugs. Substance addiction is often the most visible due to its physical effects and potential for overdose. 2. Behavioral addictions. These include compulsive behaviors like gambling, video gaming, internet use, pornography, shopping, and even food. Though these do not involve ingesting chemicals, they still activate the brain's reward circuitry in similar ways and can lead to compulsive behavior and significant life disruption. According to the World Health Organization, behavioral addictions, particularly gaming and gambling, are rising globally, especially among adolescents and young adults. Addiction develops gradually and is influenced by multiple factors. Genetic vulnerability. Research shows that genetics contribute to about 40 to 60% of a person's risk of developing addiction. Some individuals are born with a brain chemistry that makes them more sensitive to rewards or more prone to impulsive behavior. Mental health conditions. People with anxiety, depression, post-traumatic stress disorder, bipolar disorder, or ADHD are at greater risk. The overlap between addiction and mental illness is so strong that some experts refer to it as a dual diagnosis. Environmental triggers. Growing up in a household where substance use is normalized, experiencing trauma, living in poverty, or lacking supportive relationships can all raise the likelihood of addiction. Early exposure. Initiating substance use or addictive behaviors at a young age significantly increases the risk of long-term addiction. The adolescent brain is still developing, especially in areas related to decision-making and self-control, making it more vulnerable to addiction pathways. As neuroscientist Dr. Eric Nestler has pointed out, chronic drug use leads to persistent changes in brain function that can last long after the drug use stops, highlighting the deep-rooted nature of addiction. Across the world, the consequences of addiction are visible in healthcare systems, criminal justice systems, workplaces, and families. Some key examples include opioid crisis. In countries like the United States and Canada, a public health crisis emerged from the overprescription of opioid painkillers. Patients initially treated for legitimate pain found themselves dependent, with many eventually turning to illicit drugs like heroin or fentanyl. The result has been hundreds of thousands of overdose deaths, leaving behind devastated families and communities. Technology and gaming. In several Asian countries, governments have established digital detox programs to address rising addiction to online gaming and social media. Young people are particularly at risk, often spending excessive hours on screens, neglecting school, sleep, and social interaction. Studies have linked excessive screen time to anxiety, depression, and social withdrawal. Alcohol dependence. In many cultures, alcohol is socially accepted and widely consumed. However, for some, casual drinking evolves into dependence. Alcohol addiction can lead to liver disease, mental health disorders, accidents, and violence. Despite being legal, alcohol remains one of the deadliest substances worldwide, contributing to millions of preventable deaths annually. These examples show how addiction is not limited to illicit drugs. Everyday substances and activities, when used or done compulsively, can lead to devastating consequences. The effects of addiction are severe and far-reaching. Physical health, chronic diseases, liver and heart problems, infectious diseases, such as HIV or hepatitis from shared needles, malnutrition, and a weakened immune system. Mental health, depression, anxiety, paranoia, hallucinations, and suicidal thoughts are common in individuals battling addiction. Social damage. Addiction often leads to damaged relationships, loss of employment, domestic abuse, and social isolation. Economic costs. Addiction drains billions from national economies in terms of lost productivity, healthcare costs, law enforcement, and rehabilitation. Legal issues. Many people with addiction are criminalized, often for possession or behaviors related to obtaining substances. This perpetuates a cycle of punishment instead of healing. The struggle to recover from addiction lies in its deep entrenchment in both brain chemistry and behavior patterns. Even after detoxification, the physical removal of a substance from the body, psychological cravings remain. Triggers in the environment, such as stress, old habits, or certain people, can cause relapse even after long periods of abstinence. Recovery is made even more difficult by stigma. Society often judges people with addiction harshly, labeling them as weak, selfish, or dangerous. This stigma prevents many from seeking help out of fear of shame or rejection. According to Dr. Gabor Mate, an expert in addiction and trauma, the question is not why the addiction, but why the pain. Many people use substances or behaviors to cope with unresolved trauma or emotional suffering. Understanding this can shift the conversation from blame to healing. Recovery from addiction is possible, but it often requires a multifaceted and long-term approach. No single treatment works for everyone. The most successful programs combine medical, psychological, and social support. Key components include conducted under medical supervision, especially for substances like alcohol and opioids, where withdrawal can be dangerous. Cognitive behavioral therapy, dialectical behavior therapy, and trauma-informed therapy help individuals recognize triggers, build coping strategies, and heal underlying emotional wounds. Medications can reduce cravings and prevent relapse, particularly for opioid and alcohol addiction. Peer support through organizations like Alcoholics Anonymous, Smart Recovery, or Secular Alternatives provides encouragement, accountability, and shared experience. building new habits, reconnecting with loved ones, finding purpose, and developing hobbies are all part of creating a sustainable life in recovery. Access to affordable healthcare, housing, education, and employment greatly increases the chance of successful recovery. It is important to recognize that relapse is not failure. It is part of the recovery journey for many. What matters is not falling, but continuing to rise. Addiction is a deep and complex condition rooted in biology, psychology, and environment. It affects the brain, damages health, fractures relationships, and burdens society. But it is also treatable. Understanding addiction as a disease, rather than a character flaw, is essential for supporting those affected and for crafting effective solutions. Scientific research has made it clear: addiction is not a moral failing. It is a chronic, relapsing illness that requires medical care, emotional support, and societal understanding. Millions of people live in recovery, proving that healing is possible. Every human being deserves compassion, not condemnation. Addiction teaches us that pain and suffering can lead even the strongest among us to seek escape in harmful ways. But it also reminds us of the human capacity for resilience, change, and redemption. If we judge people by their lowest moments, we deny them the chance to rise. But if we meet them with empathy, support, and a willingness to understand, we create a path not only for their healing, but for a more just and caring society. The fight against addiction is not just about chemicals or behavior. It's about restoring dignity, purpose, and hope. Thank you for watching. Well now, if you've made it all the way to the end, I want to thank you, truly. It means a great deal that you've spent a bit of your day here with me. If this video stirred something in you, or gave you something to think about, I'd be honored if you'd consider subscribing. I'll be sharing more reflections like this. Thoughtful, honest, sometimes a bit heavy, but always with purpose. And if you turn on that little bell, you'll know when the next one's ready. Take care of yourself, and until next time, be well.